What are the most common eye problems people have?
The most common thing we find in our offices is people come in for obviously just a vision check for their health, but often the primary need they have is to have their glasses updated or their the signs of blur that they experience. They want to know if glasses would be something that would help them with that. So I'd say a good 50 to 70% of the time, when most patients come into an eye doctor's office, we're looking to give them a vision check and find out if they need glasses. I think the patient in their mind, that's probably 90% of what they're there for. But in our minds, we're looking to see if that blurred vision that they have is actually caused by something else. It could be a tumor, that the first sign of a tumor in the eye could be blurred vision. A tumor in the brain could often come with blurred vision. Sometimes people see flashing lights and they assume it's a normal thing, and it can be a sign of whether it's a migraine or a retinal detachment. It could be eye or brain related. And so often the most benign symptoms, even like a burning or redness in the eye, which someone can just rub their eye and feel like it'll go away, could turn out to be something more severe. So our job is just to screen out even the mildest of symptoms to make sure they're not something more severe. And often they're not, but at least the patient will leave with that sense of comfort knowing there's nothing more serious. Those rare things that we do find, they're actually not that rare. We'll find that we're often detecting diabetes within the eyes when someone gets blurred vision or a mild fluctuation. The one condition that's a bit of a surprise is glaucoma. Everybody assumes that if they have it, they would know it because they'd feel a loss of vision. Unfortunately, glaucoma has very little to no symptoms for most people who have it. It's in the more advanced stages where people will notice some peripheral vision loss or pain in the eyes, but the majority of people who have glaucoma who are living with it don't know it. And so that's one of those conditions we recommend, even doing an annual or biannual vision screening, a health check on the eyes, just to make sure that there's nothing that's being missed is always recommended.